Hello there. My name is Craig Allingham. I'm the author of Prostate Map, Men's Action Plan, a book for guys who've undergone prostate surgery. I hope you've arrived at this video as a result of reading the book. But if you haven't, that's not a problem, because I'll let you know before we're done how you can purchase the book. My background is in high-performance sports physiotherapy, working with elite athletes as well as people in my clinic. More recently, I've turned my attention and experience in high-level rehabilitation to men who are about to or following prostate surgery to help them recover as much as possible the muscle control for their bladder and erectile function. There are a series of videos accompanying the book. This is the first, and we begin with an anatomy review and a discussion of where best you can feel or palpate for when the correct muscles are working. There's no point undertaking a muscle rehabilitation program until you are 100% sure that you're engaging the correct muscles. So let's get started with the anatomy review. This diagram of the men's working parts. At the back here we have the sacrum, the lower part of the spine, finishing with the coccyx. Lumbar spine, sacrum, coccyx. In front of that we've got the rectum, the waste passage for solids and gas coming out through the back passage. In front of that we have the bladder. The bladder is the collecting site for urine as it drains from the kidneys above. In the front, obviously, we have the penis and the scrotum with the testicles. Bone at the back, and there's also a bone at the front here. This bone here is the pubic bone where the pelvis joins in front. The testes, the two testicles, have tubes that run up and carry the sperm that are manufactured in the testicles up and add it to the fluid generated by the prostate gland. This red mass here is the prostate gland, and the prostate gland sits just below the bladder, beneath the bladder, and actually the tube from the bladder, the urethra, runs through the prostate gland and continues down to the end of the penis. And that's the tube obviously through which you pass urine, through which you pass semen when you ejaculate. Key job of the prostate is to create the fluid that's added to the sperm from the testes that is passed as semen when you ejaculate. So that's our anatomy. Sacrum behind, rectum, bladder, pubic bone, prostate beneath the bladder, urethra running right through. There are some muscles associated with the prostate, but they are removed during surgery. So the backup system is the pelvic floor muscles. The pelvic floor attaches at the back to the spine and to the sacrum and to the coccyx, and it runs down and forward beneath the prostate, around the back passage, beneath the prostate, and attaches up to the pubic bone, attaches up to the pubic bone in front. So that's it. We have a downward slope. So you can see that the pelvic floor muscle scoops down and it supports the organs. It supports the back passage, the rectum, it supports the prostate and the bladder, and then it attaches in front. Things go through the pelvic floor because the pelvic floor is not just a line of muscle, it's a basin of muscle that comes out to the side as well, like a big bowl of muscle. When you contract the pelvic floor, and it's a muscle like any other muscle, when you tighten or tense your pelvic floor, because it wants to shorten, but it can't shorten because it's attached to bone at both ends and those bones won't come any closer together. If it can't shorten, all it can do is lift a bit. So as you tighten your pelvic floor, there's a lifting sensation. As the muscle tenses, it lifts the bowl. To feel whether this muscle's working, there are two ways. One is internally. Remember, and I guess you will, when the doctor was examining to find out what your prostate felt like, and he or she up through the back passage and feel up against this rear part of the prostate, looking for any change in texture or size or contour of the gland that would suggest a growth. It's not necessary for you to palpate up through the rectum to feel whether this muscle is working. That's something that can be done in the clinic. However, you can feel whether the pelvic floor muscle is activating by palpating or feeling in this area. The area between the scrotum and your back passage opening. This is called the perineum. And all there is there in the perineum between the skin and the pelvic floor muscle is a bit of fatty tissue. So if you were to push your finger up here in this area of the perineum and push in against the fatty tissue, you would cause pressure against the undersurface of your pelvic floor muscles. And now when you activate those muscles, when you actively tense the pelvic floor muscles, you will feel a firming under your fingertips of that muscle contracting. As if you were going to contract your biceps muscle. It starts soft, but when you firm it and contract it, it becomes quite firm, quite tense. The same thing will happen because it's the same type of muscle with the pelvic floor. This is a skill you need to practice because it's difficult to be confident that you're feeling that. There are a couple of cues to turn this muscle on for you. The second one is to imagine you are shortening or retracting your penis back into your body. So the first one lifting the testicles, the second one retracting the penis. The third strategy is to imagine you are passing urine at the toilet, you're taking a leak, and you want to interrupt the flow midstream. And as you do that, without pinching with your hands, try to interrupt the flow midstream using the muscles internally by clamping shut the urethra, activating the pelvic floor. And if you are feeling in this perineum area with your finger, as you do any of these three exercises, any of these three triggers, you should feel a tightening, a firming of the muscle tissue to confirm you're in the right place. If you're not sure, move a little bit forward, backwards, a little bit to left, to right, just to see if you can find an area where you can definitely feel some firming. Because until you get that correct,